Hi, my name's Greg Fell and I'm Director of Public Health in Sheffield, and it's a brief piece on face coverings. It seems a very contentious issue. It oughtn't to be, so I'll try and correct some of the misinformation and dispel some of the myths, I guess. So, we've all seen stories of on the news or posters or social media about face coverings in public places. There are lots and lots of different views, and it's confusing, so I'll try and correct some of that. Throughout this piece I'll talk about face coverings, not face masks. We're deliberately talking about face coverings, and we're reserving face masks for NHS and social care professionals. So here we're talking face coverings. It's important I say at the outset that they're not a panacea. The things that make most difference to reducing transmission are, in order, staying at home if you have symptoms of the illness, distance from other people, frequent hand washing and catch it, bin it, kill it. Face coverings is an order of priority lower than that, and it's really, really important to be clear on that one. All that said, they have some benefits, particularly benefits in enclosed public spaces, and of course it's now the law that on public transport you wear a face covering at all time, and most NHS settings will ask people to wear a face covering when indoors on an NHS premises. Myth 2, a face covering doesn't protect me from somebody else's virus. It stops me transmitting my virus to somebody else. So the droplets I breathe out, if I happen to have an infection, it stops that rather than it kind of protects me from somebody else's virus. Where they're really, really important is in the if I have an asymptomatic, an illness with no symptoms, or I have the virus but I'm prior to developing symptoms, I can still transmit the virus. So wearing a face covering in that context can really, really make a difference. So Public Health England are pretty clear. Use face coverings in enclosed public spaces where you can't keep distance from other people, and particularly where you come into contact with those that you wouldn't normally meet. My rule of thumb, in closed spaces, close contact, particularly crowded spaces, those are the things that worry me most. So that for me would be the where and when I would think about wearing such a thing. Wearing a face covering outdoors doesn't confer much benefit to anybody, actually. So yeah, we do see lots of people wandering around with face coverings outdoors. People can make that choice, it's fine, but it doesn't actually confer a great deal of benefit. Where they have benefit is in indoor spaces, particularly public spaces. So how to wear these things? I'll say at the outset, not wearing one properly is probably worse than not wearing one at all. And I see lots of people, I've just been for a sandwich, I see lots of people wandering up and down the street with face coverings hanging off their chin or not covering their nose and their mouth. It's really, really important that you wear them properly, otherwise it's just not worth bothering. Make sure the covering covers your mouth and your nose, whilst you've clearly got to be able to breathe still. Wash your hands or use hand sanitizer before putting it on and after taking it off. And if you're helping somebody else put a covering on, do the same. Wash your hands or use hand sanitizer. Avoid touching your eyes, nose or mouth at all times. One of the concerns is that I have this covering on and therefore I might inadvertently fiddle with it whilst it's on my face. That is a transmission point. As soon as I put my hand on the surface, I then put my hand to my mouth or my face, that's a potential transmission point. So the more you touch your eyes, nose or mouth, the more risk there is. If you're using a reusable one, then store them in a plastic bag until you can wash it. If you're using a disposable one, put it in a bin. We see lots of them disposed on the street. Just put it in a bin, please. And once you've removed your face covering, clean any surfaces that you put that on, because if you have an asymptomatic illness or you're prior to symptoms, you put that on, that's going to be covered in your respiratory book. Somebody else may touch that touch point. Wearing them with glasses is sometimes a bit of a problem. They cause glasses to fog up. It's just one of those things that we've got to be mindful of. And then lastly, who? PHE advice is wear one if you can, particularly in an indoor enclosed public space where social distancing isn't possible. And if you can, there are many that can't. Very young kids can't really. Very old people may not be able to, because they may not be able to use them unaided, or because of another reason. So there are exemptions from using face masks. But what the ask is that if we're going to use face masks, that we all use them. All of those that can use them do use them.